In 2018, the UK introduced a tax on sugary soft drinks. The prediction? Companies would just pass the cost to consumers and nothing would change. The reality? A 47% reduction in sugar content across the industry and a 29% drop in children's tooth extractions. I'm Dr. Fergal Armstrong, and today we're looking at how a simple tax can reshape an entire food industry and why we need to go further. Let me tell you why the UK's soft drinks industry levy is one of the most successful public health interventions we've seen in years. Before the levy was even implemented, just from the announcement in 2016, manufacturers started reformulating. They didn't wait to be taxed, they changed their recipes to avoid it. By 2024, the government review found a 47% average reduction in sugar across soft drinks in scope of the levy. 89% of soft drinks now sit below the tax thresholds. That's 750 million kilograms of sugar removed from the nation's diet. And here's what matters for health outcomes. Research from the London School of Hygiene and Tropical Medicine found children's sugar intake dropped by nearly 1 teaspoon per day within the first year. Adults saw reductions equivalent to more than 2 teaspoonfuls daily. Hospital admissions for dental caries, tooth decay requiring extraction, fell by over 28% in children under 4. This isn't theoretical. Over 73 countries now have some form of sugar tax. It works. So the question becomes, if taxing sugar in drinks works this well, why stop there? The National Food Strategy proposes extending this approach to processed foods through a sugar and salt reformulation tax. The specifics: £3 per kilogram on sugar and £6 per kilogram on salt sold for use in processed foods or catering. This mechanism is elegant. It achieves two things simultaneously. First, reformulation. Manufacturers have a direct financial incentive to reduce sugar and salt content to lower their costs. Exactly what we saw with soft drinks. Second, discouragement. For products that genuinely cannot be reformulated, think confectionery, the increased cost may be passed on to consumers, making the least healthy options less economically attractive. Now, critics will say this is a tax on the poor, but the evidence from the soft drinks levy tells a different story. The largest reductions in sugar purchasing occurred in the most deprived communities. When manufacturers reformulate, everyone benefits equally regardless of income. Here's where the strategy gets genuinely clever. The revenue from this tax doesn't just disappear into government general coffers. It's proposed to be reinvested directly into addressing health inequality. Specifically, using the money to help get fresh fruit and vegetables to low-income families. That closes the loop. You're not just making unhealthy food less attractive, you're making healthy food more accessible. And there's a second component that I think deserves more attention. Mandatory transparency. The proposal requires large food companies, those with over 250 employees, to publish annual data on their sales of high-fat, sugar and salt foods, their protein sales by type and origin, fruit and vegetable sales, and food waste. This matters because what gets measured gets managed. When companies know their numbers are public, when investors, consumers, and regulators can track progress toward national health goals, that creates accountability that voluntary pledges simply don't. So what does this mean for you practically? First, understand that policy change is possible. We have proof the soft drinks levy worked and public support helped make it happen. Second, when these reforms come to your grocery aisle, expect to see products reformulated. That's the goal. More choice, not less, just healthier choice. Third, stay informed. When food companies start publishing their health metrics, pay attention. Your purchasing power is a form of accountability too. We've established that education and willpower alone won't break the junk food cycle. The soft drinks levy showed us that well-designed policy can reshape an entire industry. Extending that to sugar and salt in processed foods isn't radical, it's logical. I'm Dr. Fergal Armstrong. Subscribe to MedHeads for more evidence-based health insights. Until next time, look after yourselves.